welcome back to Straightforward. I'm continuing my conversation with the awesome team from Renal Associates. Dr. Alapan is joining us. Welcome.
Thank you very much for having us here.
Well, you all are the best and the brightest in your field.
Thank you.
I am a personal witness to that.
Thank
you all have worked so hard with putting together a super team. How did you get all of this talent to come here to Columbus?
Well, I think our practice started with our senior doc, who was Dr. Kumar.
Okay.
And he was a single person. And then my colleague, Dr. Alkit, came and joined him in 1994. And I joined the team in 2000. So two of us started off, and then Dr. Chauhan came and joined us in 2003. Then came the other two folks in 2009, and recently, as recent as a year and a half. So we are actually a very diverse group. We not only embrace, the recent joined doctors, two of them, from UAB, and I graduated from Yale, New Haven, from Connecticut.
Oh, okay.
And my friend Dr. Chauhan did from University of Virginia College of Commonwealth University.
Oh, wow.
And Dr. Alkit came from sunny Buffalo, New York.
Really? So you have all of this talent. We have, of course, Dr. Smith, very proud Alabama person, but you have talent from across the country.
Yeah, we got to complete our practice, Renal Associates. Actually, we are very diverse in terms of where we graduated, but ultimately what matters is what we deliver and how we take care of our patients. And our team is very unique in the sense, of course, everybody will claim everybody is unique, but we have such a cohesive unit.
Oh, it's like family.
We always just like that.
I can say that because even in the care of my father, who has moved on, you all did an excellent job. He became your patient at 90 years old. And regardless of what doctor came in to see him, it was top 5-star care. Nothing fell through the cracks. And that's what if it wasn't right, he would tell you that.
I'm sure.
Really. And so I think that goes to the camaraderie that you built with this team.
One thing we made sure is that the person we chose, or at least I joined, we made sure that the person who's with us will have the same like-mindedness, and the care for the patient is number one. If anything you cannot find fault with us is our care is always the best what we try to give. At least we try to do the best, and we do not let our patients down in any way, no matter if it is in the medical care or even outside their social support. In our practice, we always feel it's not just the patient alone. And the family members are as equal as important for us as the patient. If we don't take care of the family and the patient together, it's going to be a disaster. The reason is the patients we deal with are very sick folks.
Yes.
And they are on the fringe of their life, not knowing what is to expect down the line. And things happen. Many times they'll have very small, trivial questions, which may be trivial to us as doctors, but it's a big question for them. So for us, to make them happy and comfortable and make them feel that they are under the right doctor's care. That's basically what we do.
Well, and I can attest to that. I mean, whether it's in rehab, which you would show up there, you're serving people in Alabama and Georgia and multiple counties. Anytime or day or night, you all would just show up and all of the questions. And we were a very high maintenance group, our group. and you were always very patient, but no, that's a good thing. And that is why I can so freely recommend your team, because if you could survive us with all of our questions and how high maintenance we were, and then as so demanding as Daddy could be sometimes, that really is what families are looking for, because as you said, it is a very serious time when, they're coming with you.
Very important. Dr. Chan will agree with us. First thing we try to do is when we see the patient, we find out who the family members are, and we bring them in, and making sure that they are also sure of what is happening, because at some point in time of this patient's life, they are going to be in a position they will not be able to take care of themselves.
Exactly.
At that time, if the family member comes in and does not know anything, then they're going to be really in big turmoil, emotionally, and also physically how to handle this. It's not easy.
And so you all would come in and I would see you, and you are picking up the ball and answering the questions, and before it just over. It's like, so do you have anything else? And I think that's important, because as lay people, we don't really understand the big picture. And as you said, all the family members really need to be on the same page.
Yeah, I think that's what I told you earlier, how to educate the patient and patient's family member, and how to empower them to ask the right question as well. Because, you know, this is not a small condition, especially sometime when you're on dialysis. Your needs are for years. Many more years.
Yes.
And then those questions need to be answered properly, and so they can work with the patient and patient's family together.
So when you went into the other communities, were people very receptive? I mean, I'm so very thankful that you all have been here. And of course, you came in the 90s and you came in 2000. So you all have been established for a very long time. It's not that you're new to the community, but when you went outside of Columbus Metro, were people just really excited?
You know, the way how you look at kidney disease, it is there in everybody beyond certain age.
Yes.
Only thing people don't know that they have. So immediate thing amongst us right now is to see how to bring that to the forefront, to allow the people to know that everybody is having some little kidney disease, but not to worry about it.
Right.
And to let them know what are the things we can do, either to prevent worsening, or to make sure that whatever is happening right now, we can hold it where it is, so that it doesn't slide down quickly into a stage where they have to go on dialysis.
Right.
We are always being told, as earlier, that we are doctors who deal with dialysis. But it's not that.
It's a myth.
It's
You
a
deal with
myth.
more
We
than
are
that.
not just dialysis doctor. Our practice of as a nephrologist or a kidney doctor means we take care of the patient outside, and we also take care of the patient in the hospital. Half of our work is also in the intensive care unit. All the sick folks who are all in kidney problems, we are the one taking care of them. And we are actually one of the ones they will always seek our help as soon as somebody goes into problem. So we do have those two levels. We take care of them outside, we take care of them inside. Now coming to the other doctors who want to handle this, they always have that little hesitation how to take care of kidney patients, because it's a very complex, kidney is a very complex organ.
I'm sure.
It's not very easy. So because of that, we find that we are the ones in the forefront to take care of them. Kidney controls most of the parts of the body, and everything affects the kidney. Anything goes wrong with the heart, anything goes wrong with the lungs, anything goes wrong with the liver and the brain, all the things will show some effect on the kidney. That's why we are always there in every kinds of disease what we have.
Wow.
So that's important to know. And then when we go to the community to talk about, Dr. Chauhan mentioned, education of the community or the people is very important.
Oh, it is.
We are sitting and talking today to a segment of people who are very, very vulnerable, and where the incidence of the kidney disease is very high.
Oh, I know. And we're in the Bible Belt, and we just eat everything that we want and too much of it.
Bible Belt is one thing, but Columbus, the southwest of Georgia, has got the highest incidence and the prevalence. At least we can know for now. The exact number, this is about 6 years ago. The numbers, we still have the highest number of dialysis patients and kidney disease.
Really?
Yes, and Georgia is #1 in the nation.